This is Chris Barnhart with Healthcare Sales 101. When I'm out looking for new solutions for my healthcare clients, I'm always happy when I can find that concept that I know is going to make the clinicians happy. But what's kind of exciting is when you can find that solution that's also going to make the CFO and the CEO happy. But equipment management rails can do both. That's what's exciting about them. When you look at both parties, the clinicians are easy. It's obvious what the rail system does for them. It's an enhanced efficiency, patient-centered care, improve age caps, facilitate terminal cleaning. You can do part-level inventory in clinical rooms. And obviously, a rail system allows for a clear floor space, which reduces trip hazards and makes it a lot easier to keep clean. So of course, all the doctors, the nurses, the techs, and even the patients love the rail systems. So the real question is, how can you get the C-suite on board? Well, it's a lot easier than you think. The easiest way to explain this is to use an example. And in this example, we're going to use a 250-bed facility. And let's start with the traditional wall-mounted solution. In this case, we're going to have a hand soap dispenser, a paper towel dispenser, a foam dispenser, and to install this, of course, is going to be labor involved. So we're looking at a total cost of about $105 per bed, and we have 250 beds, so the total expense on the traditional wall-mounted solution for the install, around $26,000. This is where some people might stop, but you can't, because what's going to happen that following year? The purchasing is going to find a new supplier. In this case, in our example, let's say the purchasing finds a cheaper infection control unit. That means that you're going to have to folks go back into the room. They're going to remove the old device. When they remove that wall-mounted device, there will be damage to the wall, whether that's in the form of screws or ripped sheetrock. So the wall's going to have to be patched and it's going to have to be painted. So what does this really mean? It's closing that patient room. That's where your real cost is. So if we add up all these costs, what you end up with is an impact every time you change one supplier of about $422.50 per bed. In our example, we had 250 beds. So overall, we're looking at a negative financial impact for every item that you change, over $105,000. Now let's take a look at a wall-mounted solution. Same example, 250 bed. You're going to have these same units installed. In addition to that, these units will have mounting plates, and there will be an equipment rail that's also added in. Overall, the total expense is $291 per room. Again, multiplied by the number of rooms we had, creates a negative financial impact of $72,750. Okay, I want you to notice here, there is a front-loaded expense here. Rail systems do cost more to install than traditionally mounting them straight to the wall. But let me show you where the magic happens. Let's take a look at this rail system and what happens the following year. To change out the device now that it's on a rail system is 15 minutes. There's no damage to the wall, there's no painting, and most importantly, you don't have to close the room. So the total expense to change out this unit is only going to be $1,250 total. If you compare these two on the first change, you can see the savings that occurs. Okay, I've thrown a lot of numbers at you. Let me show you what this really looks like graphically, because we've only talked about one change before. Let's talk about the total cost of ownership in our example. First, let's put in the installation cost, both for wall-mounted and rail-mounted. Now we can take a look at what happens after the first change. As we talked about earlier, we know these costs, so we can graph these in for wall-mounted and then for rail-mounted. Now what becomes really interesting is when you look at the second change and the third change and the fourth change and so forth and so on. If we put that additional cost for each one of those changes into the graph, the differences between wall-mounted and rail-mounted really becomes obvious. There's a drastic cost savings when it comes to using a rail-mounted product. Now the rail system, the upfront cost we talked about before, is going to cost you about $46,000 more. But look what happens on the first change. That rail system has to recoup that cost, and in fact it saves you about $57,000. Now what's really interesting is by year 5, You have saved, by using a rail system, you saved over $479,000 in savings. To simplify this even more, the bottom line is this. There is a front-loaded cost to install, but that cost is minute when compared to the first time you make a change with the product. If you were to take a look at that over 5 changes, it makes no sense to go with a wall-mounted unit. So when you have a solution for a healthcare client that not only makes clinical sense and will make all the clinical people happy, but also makes economic sense and can make all the C-suite happy, it's an easy decision to make. Rail Systems is a product that should be in every healthcare facility.